On December 26, 2017, RaDonda Vaught, a nurse at Vanderbilt University Medical Center, administered medication to a 75-year-old patient, Sherlyn Murphy, prior to a PET scan. In the PET scanning room, the patient was arrested and was placed on a ventilator. On the same day of December 26, 2017, it was found out that RaDonda Vaught administered the wrong medication, Vicaronium, to a 75-year-old patient, Sherlyn Murphy, instead of the sedative first. Vaught was working in an unfamiliar environment and was under pressure, leading to quickly administering the medication without precaution. She made several errors in the medication administration process, including failing to verify the medication with another nurse, failing to check the medication label carefully, overriding safety features on the medication dispensing cabinet. The medication Vicaronium that she administered to the patient, Sherlyn Murphy, it is a paralytic drug which led to a total muscle paralysis and stopped Murphy's ability to breathe. Vaught immediately reported the medication error and Murphy was resuscitated. However, Murphy suffered severe brain damage and died a few days later. Vaught was fired from Vanderbilt University Medical Center and later charged with reckless homicide and impaired adult abuse. In 2021, her nursing license was revoked by Tennessee Board of Nursing. But before going deeper into that, let's further tackle the incident which led RaDonda Vaught's license to be revoked.
For the assessment, patient name was Sherlyn Murphy, a 75-year-old woman with a brain bleed. She complained of respiratory arrest. Murphy was admitted to Vanderbilt University Medical Center for a brain bleed. She was intubated and sedated, and she was receiving a number of medication, including burst a sedative. Physical examination revealed Murphy was unresponsive and had no respiratory effort. For the diagnosis, respiratory arrest due to Vaught overdose. For the planning, goals are to restore Murphy's breathing and to prevent further complications. For the intervention, administer naloxone, an antidote for neuromuscular blockers. Provide mechanical ventilation, monitor Murphy's vital signs closely, and to treat any complication such as seizures or cardiac arrhythmias. For the implementation, naloxone was administered and Murphy's breathing began to improve. Murphy's was placed on mechanical ventilation, Murphy's vital signs were monitored closely, Murphy's was treated for seizures and cardiac arrhythmias. For the evaluation, Murphy's breathing improved and she was extubated a few days later. Murphy suffered severe brain damage as a result of Vicaronium overdose. Murphy died a few days later. For the conclusion, despite the interventions that were implemented, Murphy died as a result of Vicaronium overdose. This case highlights the importance of preventing medication error. The medication error in this case was likely caused by a combination of factors, including Vaught's lack of experience in the unfamiliar environment, the malfunctioning medication dispensing cabinet, and the lack of double-checking procedures. Also, it is important to learn from this case and take steps to prevent similar medication errors from happening in the future. This includes implementing safety measures such as double-checking procedures, training nurses on medication safety, and repairing malfunctioning medication dispensing cabinets.
So what would be the judgment for this case? Going back to RaDonda Vaught's case, she was fired from the hospital after that incident. The Tennessee Board of Nursing initially reviewed the matter and closed it with no finding against Ms. Vaught. The hospital reportedly settled a civil lawsuit out of court with Ms. Murphy's family way back 2018. In October 2018, an anonymous source reported the incident to the state and federal authorities. The CMS, or Centers for Medicare and Medicaid Services, conducted an inspection at Vanderbilt and issued a statement of deficiencies concerning the patient's death. A criminal investigation was also initiated, and Ms. Vaught was indicted in 2019 for reckless homicide or Class D felony and physical abuse or gross neglect of an impaired adult or Class C felony. The Tennessee Board of Nursing re-evaluated the matter and revoked Ms. Vaught's nursing license in July 2021. The criminal trial began on March 21, 2022. Then, on Friday, March 25, 2022, former nurse RaDonda Vaught was found guilty of criminally negligent, homicide, and gross neglect of an impaired adult. These convictions came from Vaught's medication error that killed the patient, which is Charlene Murphy in 2017 at Vanderbilt University Medical Center, and she could face up to 8 years of prison for her mistake.
The judge who sentenced Vang said that she took into account the seriousness of the offense, but also Vang's lack of criminal history and her remorse of her actions. In 2022, Vang was convicted of criminally negligence, homicide, and gross neglect of an impaired adult and was sentenced to 3 years of probation on May 13, 2022. He was also ordered to pay $50,000 fine and perform 300 hours of community service. The RaDonda Vang case is a complex and tragic case that has raised important questions about the role of nurses in medication errors and the responsibility of healthcare organizations to create safe environments for patients' care. It is important to remember that Vang made a serious mistake, but there are also many factors that contributed to the medication error. The core ethical principles of beneficent, non-maleficent, autonomy, and justice are abundantly present in cases of medicine errors. First, beneficent represent the obligation of the healthcare provider to act towards the benefit of the patient. When medication errors are present, the health of the patient is at risk, especially when not mitigated as soon as the error is discovered. This demonstrates an act that opposes the beneficence and serves harm to the patient in contradictions to helping them. Second, non-maleficent is the obligation of the healthcare provider to not harm the patient. Alongside the act of incorrect medication administrations, disclosure of stated medicine error can also serve as an act that opposes the ethical principles of non-maleficent. In accordance with the CDC, healthcare providers have an obligation to report when medicine errors are made and take corrective actions to prevent this mistake from occurring again.